Hi, welcome back to Let's Talk Mental Health, and today we are going to be talking about serotonin syndrome. Unfortunately, things are still how they've been, so still doing these types of videos until Bree and I can get together to film, but I do have a video I am planning to film, just trying to gain the energy to do so. So without further ado, here's the presentation on serotonin syndrome. So to get started, what is serotonin syndrome? Serotonin syndrome occurs when you take medications that cause high levels of the chemical serotonin to accumulate in your body. Serotonin is a chemical your body produces that's needed for your nerve cells and brain to function. But too much serotonin causes signs and symptoms that can range from mild shivering and diarrhea to severe muscle rigidity, fever, and seizures. Severe serotonin syndrome can cause death if not treated. Serotonin syndrome can occur when you increase the dose of certain medications or add new drugs to your intake. Some illegal drugs and dietary supplements also are associated with serotonin syndrome. Milder forms of serotonin syndrome go away within a day of stopping medications that cause symptoms, sometimes after taking drugs that have serotonin. What are some symptoms of serotonin syndrome? Serotonin syndrome symptoms, that's a tongue twister, usually occur within severe hours of taking a new drug or increasing the dose of a drug you're already taking. Signs and symptoms include agitation or restlessness, confusion, rapid heart rate and high blood pressure, dilated pupils, loss of muscle coordination or twitching muscles, heavy rigidity, severe sweating, diarrhea, headache, shivering, and goosebumps. There are some severe symptoms that mean it's becoming life-threatening. Signs include high fever, seizures, irregular heartbeat, and unconsciousness. Back, I said. When to see a doctor. If you suspect you might have serotonin syndrome after starting a new medication, increasing the dose of a drug you're already taking, call your doctor right away or go to the emergency room. If you have severe or rapidly worsening symptoms, seek emergency treatment immediately. Sorry, I'm screeching on this on my phone for the first time. Causes of serotonin syndrome may occur if you are taking an antidepressant with a migraine medication, which is what I'm currently doing. It's been fun. It may occur if you take an antidepressant with an opioid medication. Excessive accumulation of serotonin in your body creates the symptoms. Under normal circumstances, nerve cells in your brain and spinal cord produce serotonin that helps regulate your attention, behavior, and body temperature. Other nerve cells in your body, primarily your intestines, also produce serotonin. Serotonin plays a role in regulating your digestive process, blood flow, and breathing. Although it's possible that taking just one drug that increases serotonin levels can cause serotonin syndrome in susceptible individuals, this condition occurs when you combine certain medications. Another cause of serotonin syndrome is intentional overdose of antidepressant medications. A number of over-the-counter prescription drugs may be associated with serotonin syndrome, especially antidepressants. Illicit drugs and dietary supplements also may be associated with the condition. There are some type of medications that cause serotonin syndrome. Different antidepressants, like Prozac, Zoloft, serotonin and norepinephrine, that drug that Bree and I talked about in the PTSD video, that Bree could not pronounce for the life of her. Here are some other medications. You can just read that at your own pace. I can't pronounce any of it, no matter how hard I try. Lithium, illicit drugs, including LSD, ecstasy, cocaine, and amphetamines, herbal substances, over-the-counter cough and cold medications as well. Risk factors. Some people are more susceptible to the drugs and supplements that cause serotonin syndrome more than others, but the condition can occur in anyone. You're at increased serotonin syndrome if you recently started taking an increased dose of a medication known to increase serotonin levels. You take more of one drugs known to increase serotonin levels. You take herbal substances knowing that they increase serotonin levels. You use an illicit drug known to increase serotonin levels. Serotonin syndrome generally doesn't cause any problems when serotonin levels are back to normal. If left untreated, serotonin syndrome can lead to unconsciousness and death. Sorry, I can't speak. Prevention. Also, talk to your doctor about possible risks. Don't stop taking any medications on your own. If your doctor prescribes a new medication, make sure the other medications you're taking, especially if you receive prescriptions from more than one doctor. Diagnosis. No single test can confirm a serotonin syndrome diagnosis. Your doctor will diagnose the condition by ruling out other possibilities. Your doctor will likely begin by asking about your symptoms, medical history, and any medications. Serious reaction to certain medications such as anesthetics, antipsychotic drugs, and other agents are known to produce these severe reactions. Your doctor may order additional tests to rule out any causes of your symptoms. Tests may include blood and urine tests, chest x-ray, CT scan, and spinal tap. Treatment of serotonin syndrome depends on the severity of your symptoms. If your symptoms are minor, a visit to the doctor and stopping the medication causing the problem may be enough. If you have symptoms that are concern to your doctor, you may need to go to the hospital. Your doctor might have you stay in the hospital for several hours to make sure your symptoms are improving. If you have severe symptoms, you'll need intensive treatment in the hospital. Depending on your system, you may receive the following treatments: muscle relaxation. Benzodiazepines such as diazepam or lorazepam can help control agitation, seizures, and muscle stiffness. IV fluids, breathing oxygen to treat dehydration and fever. A breathing tube and machine and medication to paralyze your muscles. You may need this if you have a high fever. And that is the presentation on serotonin syndrome. I hope everyone enjoyed it. And be sure to like, subscribe, and hit that notification button to be notified when we upload. Hopefully Bree and I will upload soon. But take care, everyone.